Hello, I'm Mark Kellish-Levine. This is On the Air at 9 with all the news that matters to Leeds. The headlines for the city tonight. Connect Well, health professionals, community organisations and the council come together to launch a new system of emotional and physical support for North Leeds patients. Plus, South America, no South Leeds for our schools as they host their own Olympic Games. And later, it's National Table Tennis Day and shoppers in the centre of town are getting involved. We sent a reporter along to find out more. Hello and welcome to the programme. First tonight, health professionals in North Leeds have launched a new support system today in an attempt to provide better healthcare for people living in the north of the city. Connect Well is a social prescribing service which supports people by helping them with social, emotional and practical needs which normal clinical services traditionally don't provide. Wellbeing coordinators will now be on hand in GP practices in North Leeds to support doctors and help people to improve their health and wellbeing. Matt Millington reports.
A lesson with the Leeds People's Choir for workers in the heart of Chapeltown. But what's it got to do with social prescribing, the new health service introduced in North Leeds today? Some of these people are newly appointed specialist coordinators, trained to break down wellbeing into key principles, one being the importance of connecting with others. They work for Connect Well under the North Leeds Clinical Commissioning Group.
So our aim is to work with anybody that's aged 18 and over who is experiencing unmet social need in the Leeds community. So for example, if someone is going to their doctors with low-level anxiety, but actually no one's ever recognising that the reason why they've got that low-level anxiety is because they're in lots of debt, then our wellbeing coordinators will sit down. We've got the time to talk to people and to find out what's going on in those people's lives.
The GP was able to connect Mrs Smith to the practice's wellbeing coordinator.
The service aims to make people aware of the opportunities available to them in Leeds and how best to use them. Working out of GP practices, Connect Well aims to improve workflow for the doctors too.
Feedback from our GPs obviously suggested that people will come in to see them with other than medical problems or problems that were associated maybe to a medical condition but had a social origin. So it was an obvious touch point. But when we designed the service, we wanted to create a separate route so you didn't have to go through your GP.
Social prescribing services have already been launched in other parts of the city. Local councillors in North Leeds now want to raise awareness about Connect Well and its services.
After today launching, if you need to get in touch with Connect Well, feel free to just come into the regional centre. There's staff to help. You can phone direct. There's, if you look up Connect Well, you'll find a number, and you can go to your doctors. It's a referral service, so a doctor will refer you to it. And I think it's worth using, and just to have a look at it. It will benefit at the end.
The project is funded by the NHS with the CCG working with Leeds City Council and third sector organisations to make it happen. The project also aims to identify gaps in service provision in order to make the right improvements to healthcare in North Leeds in the future. Matt Millington, On the Air.